How is it different for the patient to do it actively, as in what you do in outdoor, or a therapist trying to achieve the same effect with manual therapy or manipulation, etc.?
You have a lot of difference. You have in first a practice, totally basic difference. When he work himself, he can work when he want, as soon as he want. When you work with a practitioner, you need to see that once a week, 2 times a week, and not exactly the time that he needs, the time that he wants to do that. That's the first thing, totally practice. After, psychologically, when you work with yourself, when you take care of yourself about your own body, it's not the same at all, not the same result that some people work on you like you have a machine, totally passively. And the last thing, according with the paradigm of the complexity, when you work yourself, you manage at the same time the dialogic system, that means psychologically, physiologically, anatomically, biomechanically, you mix all of that. You don't know the order because it's your own body, but you feel. That is a good processus, not only a procedure. Another way is the autonormalisation. That means the people give himself the space that he needs. But if he needs to do that, sometimes if he has a big problem, I don't know, between with the herniation between L2 and L3, for example, he needs to do that perhaps for all his life. It's not a problem for him. He feels so good, so well after that. It's not a problem for you to spend 1 minute a day before to go to the bed to open the space, to give more space for the disc, for the nerve, for the rational nerve, for all these parts in the area. But if a therapist does that, he can do that during 1 month, 2 times a week perhaps, but that's it. Or it's impossible, that don't make sense for the patient to be like a slave of the therapist. He needs to manage himself, his own body.